Okay. Good evening, everyone. I am Dr. Raj Bhagat. I am an interventional cardiologist working in Hoshiarpur, Punjab, a super specialty hospital called Shivam Hospital. And today we will be discussing a topic which is very important. And rather than a topic, it's a symptom which we daily encounter in our day-to-day practice. So the topic is pedal edema. Pedal edema, by definition, is the collection of fluid in lower limbs, predominantly in the feet and the ankles. So when we press the ankle or the lower leg, we will feel the dimple. We will feel a pit in the skin after pressing hard on the skin. This is pedal edema. So pedal edema is very common, and because of dependency of the legs, it becomes very important. So, and this is a feature of so many diseases. The most common is the kidney disease, followed by heart failure, followed by liver disease. These are the three most important categories of disease in which the people present with the pedal edema. So, coming to the etiology of the pedal edema, what are the causes of the pedal edema? The pedal edema grossly is because of pathophysiology. What we say is because of the leakage of fluid from blood vessels into the tissue around the blood vessels. It can happen because of certain change in the pressures, change in the osmolality, change in the concentration of the blood inside the body. Suppose if there is the protein deficiency, so blood will not be able to hold the water inside the blood vessel. So what happens is starts leaking out into the interstitium, the tissue. Second etiology is this most of the time happens because of the malnutrition, where there is the protein deficiency, or because of the liver disease per se, due to the uh, poor production of the protein in the body, and which is released subsequently into the circulation. Second is the second cause is because of the fluid overload. When there is excessive fluid accumulation in the body, so it is not accumulated in the when the pressure of the fluid goes up in the blood vessels, it starts leaking over into the interstitium and the other tissues, which is most common etiology in case of heart failure, where the pressure of veins is very high and it leaks into the circulation. Also in the chronic kidney disease, where there is not sufficient filtration of the fluid from out of the body through the kidneys. So what happens, it keeps on accumulating into the system, into the body, and it starts pouring out through the blood vessels into the normal tissues in the body. So these are the three main pathophysiologies of the pedal edema, how it develops. Uh, so coming to the investigation, how to diagnose, it has to be consulted whenever there is a pedal edema. The patient knows that there is the swelling. It has to be consulted immediately after physical examination and systemic examination by the physician. The physician has to subject the patients to some investigation, which includes some X-ray, chest to rule out the cardiac disease, ECG to rule out the cardiac disease of the heart failure, rule out the heart failure, to go for the blood test, which is mostly on the protein assessment, the hemoglobin assessment, the assessment of urea, the creatinine, and the heart failure markers, which is NT-proBNP, proBNP. Liver disease we have to rule out by going for the liver function test, kidney function test, and by estimation of the proteins in the blood. These are the common tests. Sometimes we have to go for some specialized tests as well, which include Dopplers, which includes ultrasound abdomen, which includes echocardiography, to rule out the causes of the pedal edema. So when it comes to the this was the diagnosis. When we are able to diagnose the pedal edema, then subsequently there comes the management. Management includes, if there is protein deficiency, we have to replace the protein, we have to treat the liver disease. If there is a chronic kidney disease, which means the kidneys has been damaged chronically, then we have to address the chronic kidney disease also. If there is heart failure, which is very common, can be treated with the diuretics and other treatments after optimize the treatment strategies of the heart failure. So by early detection, it can be the early manifestation of a disease. So by early manifestation, detection, diagnosis, and treatment of the pedal edema, which is an in manifestation of systemic and life-threatening disease, can prevent the morbidity, mortality, and may reduce the hospitalization due to the heart failure, other chronic ailments, which will improve the quality of life of the patient, and also will decrease the burden of cost of health care expenditure by the patient. Thank you and good evening.